Hey, good morning, everyone. It looks like are slowly getting some folks to trickle into the room. We are going to give everyone about 5 minutes to get in. We've got quite a few registrants today, so we'll try and give us until about 10:05, and then we will get going. But thank you all so much for joining us this morning. Just hold tight. So I literally just talked like 15 seconds ago, but it looks like we have about doubled in attendees that have joined in the past 15 seconds, which is awesome. So everyone who is joining now, we are going to try and get the ball rolling around 10:05. So just hang tight for the next few minutes and we'll get started, and I will continue to try to be as least annoying as possible, but y'all just hold. Hey, y'all, for folks who are just joining us, we are going to try and get started in about 2 minutes at 10:05. Just wanted to make sure that we gave everybody the opportunity to get on before we got started. Um, we will get going in just a few minutes, and thank you all so much for joining us this morning. All right, for folks who are just joining us, we are going to take about 1 more minute. We're planning to get started at 10:05. Just wanted to make sure that everybody is able to join. So we will get started in just a minute. So y'all just hold tight. All right, so we are officially at 10:05 and we will go ahead and get started. Thank y'all everyone for joining us today for NC Advocates Respond to COVID-19. We're super appreciative for everybody who's able to join, and we had a really great response of folks who registered. So thank y'all so much. I know that we are in some uncertain times during this coronavirus outbreak and pandemic that's happening across the globe. So we just wanted to take some time as an HIV community, specifically an HIV community here in North Carolina, to talk through what's happening around COVID-19, both on the statewide level and the nationwide level. So we are super excited to have some folks from partner organizations join us. We have Alex Vance from AIDS United to talk about federal policy, and Sierra Zachary from NC Child to talk about some statewide policy. And then Lee and I will talk about some of the work that we are doing and how we continue to advocate for our HIV community during this uncertain time. So just a couple of housekeeping things. Our friends at Latino in the South, we thank y'all so much for co-hosting this with us and allowing us to use your platform. We're really Judith Montenegro from Latinos in the South will be monitoring the chat function. So if you have any questions throughout the presentation, feel free to go ahead and just drop it in the chat box. And then we will try and get those questions answered at the end of each individual presenter. So we'll start with the statewide level policy and move to national policy, and then to NCAN specific, and we'll take some time after each of those to answer questions. Also just wanted to flag that we are planning on continuing these weekly webinars on Thursdays at 10 a.m. Lee is going to talk some more about that during his portion of the presentation. With so many folks being working from home and trying to move to a kind of a virtual setting in a lot of different scenarios, we just wanted to continue to keep in touch with our community and make sure that we are communicating with everyone. So keep a lookout for those. Lee will talk a little bit more about those. But I think that is it for now. So feel free to use the chat function. Let us know if you have any questions. And I will go ahead and turn it over to you, Sierra, to talk about some statewide policy here in North Carolina. So thanks so much, Sierra.
Thank you, Matt. Hello and good morning, everyone. My name is Sierra Zachary. My pronouns are she, her, hers. As Matt mentioned, I'm a board member for NCAN, and I'm the health program director for NC Child. You know, I really appreciate people taking time out this morning. These are truly unprecedented and, you know, to be honest, scary times for our country and the world. So things are moving quickly in the policy front on the state level. So I am hoping that I can try to cover as much as possible. I'm looking forward to answering people's questions. And so Matt, if you can move to the next slide. So I think since I work mostly in the health field, a lot of my notes are about like healthcare, but just thinking about on the state just level, I think pretty much daily, Governor Cooper, along with, you know, different heads of different administrations like Secretary Mandy Cohen from the Department of Health and Human Services are pretty much holding daily press events. They are, you know, keeping up their Twitter accounts and their websites, just giving people like updates of what's happening. You know, so like, for example, this week, Governor Cooper released an executive order which extended how long schools are going to be closed until May 15th. You know, we're banning mass gatherings over 50 people, and some businesses like, you know, salons, barbershops, restaurants are also mandated to be closed. We're also noticing that more local and municipalities are doing their own ways to address COVID-19. And, you know, I think we've seen like Durham, Orange County, Wake County are all doing a more stay at home or shelter in place. But moving on to health, because President Trump and also Secretary Azar on the federal level declared an emergency, this state of emergency, it really released a lot of flexibility to states to change how healthcare can be provided to to people with Medicaid coverage. And so one of the most important things was the Section 1135 waiver. I believe right now we're up to 12 states that have received approval from CMS for their 1135 waivers. And so what this really does is just really trying to help meet the care needs. As we know, there's probably going to be a surge on our health providers in our hospitals soon. So we're trying to figure out ways to decrease administrative burden. So things that maybe are covered is, making sure that providers are enrolled in the Medicaid program, allowing providers who are maybe licensed in other states to be able to practice in North Carolina. If maybe some expansions on like telehealth, telepsychiatry, and telemedicine, so that folks who are not feeling sick or maybe showing symptoms of COVID-19 aren't going into some of the places where people could be exposed and are maybe high risk. There's also the Appendix K that our state submitted, and that's really focusing on the innovations waiver, which really gets to a lot of some of the behavioral health and social emotional health, really thinking about the people like children and families with CAP-DA or CAP-C that get a lot of in-home services. So trying to figure out what are some of those telehealth ways to address people's needs. And I think I've listened to a few webinars or chats with the department, and they're saying they are kind of moving like faster than the speed of light, in that, especially with the telehealth field. But Matt, you can definitely move on to the next slide. Okay, so I think legislatively in North Carolina, I think the biggest opportunity that we see is Medicaid expansion. As many of you know, North Carolina is one of the few states that has yet to see expansion. And I know Alex is going to get to the federal policy, but many of you may have heard of the second kind of stimulus package or, response on the federal level to COVID-19, and that was the Families First Coronavirus Response Act. And there is a provision in that act that allowed for testing for uninsured individuals, but that does not include treatment. So we know that about 500,000 North Carolinians would, benefit from expansion. And so these are folks who could be at risk of, contracting the virus. We know that, as revenue decreases in our state, there's going to be more financial strain. And so it would bring the additional federal dollars to our state. We've also known through our years of advocacy for Medicaid expansion that, our rural hospitals and some of our smaller providers, have been struggling financially. This could help them, with the support that they need to address this public health crisis. Also with these executive orders of, Governor Cooper, practicing public health measures and physical distancing and closing restaurants and other places, more people are losing their income and are at risk of becoming uninsured. So we need to make sure that our safety net of Medicaid is there to support them, and that we're not putting more strain on our healthcare system here in North Carolina. So I think this is an opportunity for us to reach out to our state lawmakers and saying that this is a crisis, this is an emergency that we need to address. Okay, we can go to the next slide. So also with the state, Speaker Moore has made a select committee on COVID-19 with 4 working groups. These cover education, economic support, continuing state operations, and healthcare. The first meeting with economic support took place yesterday. And really, I think a lot of our state lawmakers, and if you are advocates and interested in any of these ideas, really need education. As we know, things are changing and moving so quickly with COVID-19 and with federal bills, being enacted. There are opportunities or responsibilities of state lawmakers to take advantage of some of the provisions in these bills. And so I think these groups are going to be meeting on, an ongoing basis. I do not know if there's a timeline. This is a little bit of a screenshot that you can find on the General Assembly's website. They are asking for comments. So I think, depending on your area, your policy area, this is a great opportunity to submit your recommendations. It does seem like, at least from what I heard listening in on the economic support working group meeting yesterday, it seems that some of our lawmakers are really listening to their constituents and hearing what problems are and trying to fix things as we're trying to implement new policy quickly here in the state. Next slide. And these are just some resources. I really think the Department of Health and Human Services is really doing a good job of updating things daily. They, post everything about some of the executive orders and changes just more administratively. There's a way to search for different areas of interest. So if behavioral health is something that you're interested in, there are all the updates kind of geared towards consumers and providers. You can submit, Medicaid questions to a designated email address. Community Care of North Carolina, or CCNC, also has a resource page so that you can look at COVID-19 cases and look at this by different, geographic regions of the state. If you want more updates by phone, you can text the number that's on this slide. There's also, I believe when you go to the DHHS website, can link you to like the unemployment insurance, procedures now that, some of those waivers have been made into place to make it easier for people to apply for unemployment insurance. And there's also a 211 number, and this can be helpful for everything. Let's say families who are saying my childcare closed, where can I find emergency childcare, or getting assistance with like, I need meals, my child, depends on school lunch. So I think that's pretty much it for me. And so I'm happy to answer questions to the best of my ability. If you have other questions or want to be linked in to some of the things that NC Child is doing, we're trying to have weekly calls on Fridays with some legislative updates. Again, it's more child focused, but you can email me at sierra@ncchild.org. And thank you again, NCAN, and for inviting me to speak. And I'm happy to answer questions.
Awesome. Thanks so much, Sierra. Judy, have we gotten any questions in via the chat function?
We didn't have any questions from the chat function, but we did have a question emailed. And the question emailed was, can someone share about why we hear about a 4 to 12 days? And I imagine this is regarding the virus, but there's no conversation what happens what to do or what happens after that quarantine period is over. Are you no longer at risk to spread the virus after the 2-week period?
Ooh, I am not a medical provider, and I do feel like the CDC and even the NCDHHS has recommendations, that change on a pretty much daily basis. I would definitely just go back and check with like the CDC and, and our Department of Health. Anyone else can feel free to speak right now, but I think that's just maybe what historically, since we've known about COVID-19, it seems like the 14-day quarantine, if none of the symptoms pop up, it might seem like you do not have the virus, but I would still just practice physical distancing and washing your hands and cleaning, commonly and, regularly touch surfaces even after that. That's just my personal stance at this time.
Great. We have another question. How long does it take citizens to receive food stamps or unemployment benefits after signing up?
So for unemployment, I think, right now, because so many workers and so many of the local businesses are filing for unemployment. I heard, I think within a week, like around 100,000 plus folks have gone on the website. I do know they're trying to fix those glitches, and because of these waivers, I think the process will move faster. I have not seen anything about an exact timeline. I know that advocates are also, I think even on the federal level for food stamps or the SNAP program are also trying to remove waivers so that people can get food as soon as possible. But I can't recall like how long it usually takes, but I think they're trying to make it quickly so that people don't have to wait too long.
Great, thank you.
Awesome. Well, it looks like we have not had any other questions come in as of now. Feel free to continue to use that chat function if you have any questions pop up. But thank you so much, Sierra, for sharing that awesome information. As Sierra shared her email, so like she said, feel free to reach out to her if you have other specific questions directly for her and the work that NC Child is doing. But thanks, Sierra, and we are now going to pass things to Alex from AIDS United. So Alex, the floor is yours.
Thank you so much, Matt, and thank you, Sierra, for that great presentation about how things are going in North Carolina. Good morning, everyone. My name is Alex Vance. I'm the Senior Policy Manager with AIDS United in Washington, D.C. And I want to talk a little bit about the federal policy that's been passed and currently being worked on in Congress in response to COVID-19. And then I'll talk a little bit about some HIV specific items, and then touch on what's missing, and then take some questions if there are any, and I anticipate there might be. Next slide, please. All right, so far there have been 3 coronavirus or COVID-19 relief packages. The first was signed into law on March 6th, and it was a stimulus, but it was a relief package totaling about $8.3 billion, of which $400 million has already gone out to states since then, which is record turnaround time. If you've ever worked with the federal government, you know that they don't turn around money very quickly. So seeing these funds from a bill that was signed into law fewer than 3 weeks ago is incredibly inspiring to see, and shows us that at least most of the government is taking this very seriously. In this $8.3 billion, it includes about $3 billion for research and development of vaccines, as well as more than $800 million for research for treatments. More than $2 billion of this is slated for the Centers for Disease Control and Prevention, or CDC, and $61 million to the FDA for their approval and testing processes for potential vaccines and treatments. The U.S. Agency for International Development receives a little more than $1 billion from this to help with international efforts related to COVID-19. More than $1 billion will go to state and local public health efforts, including community health centers and state and local governments. That $400 million that I mentioned earlier is part of this $1 billion that's been set aside for state and local governments to respond to COVID in their areas. Finally, it also authorizes about $500 million to allow for Medicare providers to administer telehealth services. Previously, telehealth has been fairly restricted, if not completely not allowed under Medicare for quite some time. Some states have been changing that for their portions of Medicare, but the federal government has recognized that because we need to be practicing social distancing, they need to relax some of the regulations and rules about administering telehealth services for coronavirus under Medicare. The second package, which was signed into law on March 18th, or C2, was the Families First Coronavirus Response Act, which totals over $100 billion. I would try to give an exact amount for this. However, the final amount appropriated under this act is flexible because it includes funds that are based on calculations and formulas and how many people apply for certain things. So there are four major buckets of programs that are funded under this package. The first is free testing for everyone who needs a test. And I say that with a caveat that we don't have a lot of tests and it is very difficult to get tested in the US right now. The second bucket is paid sick leave, and I'll go more into that in just a moment. Then we have unemployment aid and then nutrition assistance under SNAP and WIC. So back to paid sick leave. Initially, this paid sick leave was going to extend to every business in the US, but it would still exempt small businesses with fewer than 50 employees. After some pressure from large industry groups, namely fast food restaurants, specifically McDonald's, large employees, which are companies with 500 or more employees, were exempted from this paid sick leave requirement. So right now, under this act, only companies with 50 to 499 employees must cover paid sick leave in relation to coronavirus, which leaves out about 85% of the workforce. So this bill does not go far enough, and hopefully we'll see some more legislation to address paid sick leave in future coronavirus relief packages. Next slide, please. All right, so the package that is being discussed today, C3, is the Coronavirus Aid, Relief, and Economic Security Act, or CARES Act, and it totals $2.2 trillion, which signifies the largest relief package for anything in US history. It was passed by the Senate earlier this morning, shortly after midnight, in a unanimous vote, and it is currently waiting for passage in the House. And this bill does a lot. First, it provides direct payments to taxpayers. People will receive a one-time direct deposit of $1,200 for individual filers and $2,400 for joint filers, plus an additional $500 per child. This payment will be available for incomes, adjusted gross incomes up to $75,000 for individuals and $150,000 for married couples or those who file jointly. The bill also allows use of retirement funds and waives the 10% early withdrawal penalty from retirement accounts for up to $100,000 for coronavirus related purposes. The bill makes $350 billion available to small businesses to prevent layoffs and business closures while workers must stay home during the outbreak. Companies with 500 employees or fewer that maintain their payroll during coronavirus can receive up to 8 weeks of cash flow assistance. If employers maintain payroll, the portion of the loans used for covered payroll costs, interest on mortgage obligations, rent, and utilities would be forgiven. This bill further extends previous efforts from the C2 package for unemployment and injects an additional $250 billion into an extended and expanded unemployment insurance program, and expands eligibility and offers workers an additional $600 per week for 4 months on top of what state programs already pay. This deal does apply to the self-employed, independent contractors, and gig economy workers. Hospitals and healthcare systems will get around $140 billion under this act to support hospital operation, and the rest will be dedicated to providing personal and protective equipment for healthcare workers, testing supplies, increasing the workforce and training, accelerated Medicare payments, and supporting the CDC. This bill also provides All testing and potential vaccines for COVID-19 will be covered at no cost to patients. State and local governments will get $150 billion to shore up their expenses related to COVID-19, with $8 billion being set aside for tribal governments. And the last piece, which folks are still negotiating about, is the $500 billion fund for large corporations, which will be allotted as loans, loan guarantees, and other investments. These loans will not exceed 5 years and cannot be forgiven. Initially, this $500 billion was only going to be administered by the Treasury Secretary and the President himself, and that was massively problematic. So Democrats have been able to get some concessions from the administration and from Senate Republicans, and now these loans for large corporations will be overseen by a congressional oversight panel and an independent Treasury Department Inspector General, and companies that are owned by the president or his family, any other members of the administration, or members of Congress are not allowed to benefit or apply for funds under that $500 billion pot. Next slide, please. Right, so there are three things that are very important for people living with HIV from these various packages. The first is Medicaid. The federal Medicaid assistance percentage has been increased under the second package. That is the amount of money that the federal government matches for payments under the Medicaid program, and that has been increased by 6.5% for the duration of the national emergency. Governors are pushing for that to be increased to 12%, which is about what it was during the 2008-2009 financial crisis. Under the third coronavirus relief package that is waiting for passage in the House right now, Ryan White is set to receive an extra $90 million to provide for services that are impacted by coronavirus shutdowns, namely food assistance and other well-being services that are necessary to get us through this. And then finally, HOPWA is going to see a $65 million injection of funds that will be dedicated for support services, as well as nutrition, and then additional tenant-based rental assistance to keep folks stably housed during the crisis so they are able to remain healthy as possible. Next slide, please. So things that are still missing is addressing the needs of homeless populations. There have been some investments in HUD, namely through the Community Development Block Grant Program, but nothing that really specifically addresses the needs of currently homeless individuals. We saw last night the government of the city of New Orleans enter into an agreement with Hilton, Hilton and some private funders to house homeless individuals in Hilton properties in New Orleans until the crisis is over. So they're able to observe social distancing and remain healthy and be fed and all of these things. So that leads into the next point of nutrition and food insecurity. There's been some investment in that in the second package, the Families First coronavirus package, but there is not. It was not significant enough to meet the needs that we are going to see over the coming months. Third thing that's missing is codified protection for immigrants and undocumented individuals. The Department of Justice issued some interim guidance. Sorry, Department of Homeland Security issued interim guidance that said that they will not be implementing their new public charge rules for any immigrants who are seeking care related to coronavirus. So any care that is sought for COVID-19 will not count toward a public charge determination in immigration proceedings, but that is only interim guidance, and it should be codified so that DHS can't turn around and use that against folks in immigration proceedings. And then the fourth point is protection against criminalization. The Department of Justice released a memo yesterday saying that people who knowingly transmit COVID-19 to another individual, that DOJ prosecutors should consider using bioterrorism laws to prosecute those individuals. And I know that NCAN has done a lot of work on HIV criminalization, so this does not sound unfamiliar, but it is incredibly alarming that the DOJ is already leaning into that type of criminalization for things that for a virus that we don't know, one, if we carry, and two, if we have transmitted it to somebody else. Next slide, please. One final thing I'll say is that COVID-19 has become an increasingly important policy vehicle, and we will be discussing it a lot at AIDS Watch, which is next Monday, and we hope you all can join us for that. It is completely virtual. Learn more and register at aidsunited.org/AIDSWatch. Next slide. Thanks so much. That's my email address. Please reach out to me with any questions, but I will happily take some questions now. So again, I'm Alex Vance, Senior Policy Manager with AIDS United, avance@aidsunited.org.
So we have a few questions from the chat function.
All right.
The first question is, do you know if direct payments to taxpayers under the CARES Act are considered loans that would need to be repaid with 2020 taxes, or grants to taxpayers?
They are not considered loans.
Thank you.
Thank you.
And then we have another question. If someone is newly entering the workforce after graduating from school, are they eligible for unemployment benefits under current state requirements? And that might be a question for Sierra.
I don't know if we have Sierra on anymore.
Okay. I have another question for you, Alex, from the chat. Are senior citizens included in the stimulus package? Low-income families who may have not worked last year, who may have received public assistance, will they receive any stimulus payments?
That's a great question. I'm sorry that I did not cover that earlier. So yes, the direct payments are still true and happening even for those who have no income, as well as those whose income comes entirely from non-taxable means-tested benefits like Social Security.
Great, thank you. Do you have any suggestions about how we can advocate for required sick leave for companies over 500 people?
Reach out to your congresspersons. Please call your representative in the House of Representatives and both of your senators and say that protection for paid sick leave for all employees is important, especially for companies that employ more than 500 people.
For documented residents who accept the CARES assistance, would that impact their ability to acquire citizenship in the future? So I imagine
the Department of Homeland Security has issued guidance that says any documented residents who accept. Let me back up. So is this question about direct payments, or is it about health care receipt?
Direct payments.
I would need to circle back on that. I need to verify that residents and that documented residents are covered under these direct payments first.
Okay.
So I'll follow up on that and get back to you.
Great, thank you. Are folks who are non-tax filers, will they have to file a return to access the $1,200?
They will not have to file a return, but there will be guidance that comes out from the Department of Treasury. So under the direct payments, there's some money that's been set aside, or in addition to direct payments, there's money set aside out of that 2.2 trillion for the Department of Treasury to do a public awareness campaign about how people are able to access these direct payments. So for people like me, who I did not receive a tax refund in 2018, I had to pay. So I didn't have a direct deposit information attached to my tax return. So for people like me, I'm going to have to, I have to go through another route to get that $1,200 direct payment. And the Treasury is responsible for communicating that information to the public. So once this bill passes, expect to see that information come out from the Department of Treasury very soon.
And are recently graduated students who did not work last year eligible for direct payment?
Yes. So individuals who do not have income are eligible for direct payments.
Great, thank you.
As well as folks whose income comes entirely from the gig economy or independent contractors or those who are self-employed.
Great, thank you. And I just wanted to highlight that in the chat function, Jacqueline Kleinmore has been posting some really great resources and links. So check those out. Thank you, Jacqueline. And then we have one more question. Would people who file taxes but are undocumented, would they get financial assistance?
That is uncertain, but I can follow up with some of our partners in the immigrant rights community so that I can get that information.
Okay, and all right, last question, I guess. Any details on student loan relief?
So right now, the Department of Education has suspended interest for student loans for the duration of the national emergency, but nothing has been said about suspension of payments yet. That is being considered.
Great, thank you.
Mm-hmm.
Awesome. Well, thank you so much, Alex, for all that great information. I did see somebody ask in the chat function if these slides will be available. I know we've covered a lot of different topics, both on statewide and national policy. We will be able to share these slides afterward, so we will plan on sending that out to attendees via PDF, just so you have this information in your wheelhouse. But again, thanks, Alex, so much for joining us. It was great. All right, and now I am going to pass things off to Lee.
All right, I've unmuted myself. Matt, can you hear me okay?
Yes, you are good.
Awesome. Well, thank you again, everybody, for being on this call. I want to give a big thanks to Sierra and to Alex, excuse me, for joining us to provide some information. We know sort of the situation about how we're all responding to this pandemic is really evolving and shifting, and know that, you know, one of the roles we want to continue to play is to provide good information about to our network, both about how you can be active to advocate for the things that we believe people living with HIV and people who may want to access other health services need, and also, you know, how to make sure you can get the care that you need. I did want to take a couple of minutes now just to talk about sort of how this is shifting the landscape for the priorities that we as an organization have. For folks on the line who don't know me, I'm the executive director of NC AIDS Action Network. Been really honored to be part of this organization and work with it and a great team here for the last 5 years. We have a number of policy issues that we were certainly hoping to move either through local issues, through the legislature, or be part of some broader coalitions on this year. As our team has been assessing and evaluating, we're realizing that some of those are things that we actually feel greater cause to advocate and be moving around, and some are things that just get put on the back burner for a bit. So with the time left, we're going to hit on a couple of these. The first is just wanted to note, we think there's a lot of value in talking about harm reduction issues right now. We know that for people who use drugs or for people who may be struggling with other challenges, this is a time that people do still really need services. We've been in conversation with a number of the folks providing syringe exchange programs around the state and hearing how they're adjusting and thinking differently about how to provide those services, and want to highlight that work. I'll talk about this at the end, but in 2 weeks during this Thursday at 10 a.m. time, are planning to have a webinar specifically focused on some harm reduction work. We also just want to note that one of the priorities we had for this year was to really continue to advocate and speak out about why our syringe exchange law in North Carolina is good and critical and needs to stay strong. To be honest, given this changing landscape, I would be surprised if we saw any kind of threat to the syringe exchange law, but just know that with our partners at the North Carolina Harm Reduction Coalition and other folks in the state, we're certainly going to continue to be strong advocates and monitor that law as things move forward. Many of you have been active, moving on to the second bullet, of efforts we've had in the past to raise up the need to increase state government funding for both HIV and hepatitis funding, and the great work that our communicable disease branch does. We had hoped to be able to advocate for an increase for that program this year during the legislative session. Many of you were involved in 2017 when we were able to secure a 2-year appropriation of $1.2 million, $600,000 a year, to directly fund some hepatitis work in the state. We continue to believe that work is really critical. We know the opioid epidemic continues to hit this state really hard. Certainly are concerned again about sort of changes of practice and folks in isolation, how they might be struggling with issues of addiction, with issues of drug use, are concerned about people being able to access testing and treatment for hepatitis and for HIV in this time, but also I think know that that work might be really, really challenging given sort of what we might expect the priorities to be at the legislature this year. So we're continuing just to think about, how do we lift up this work, but how do we do it in a way that's appropriate? And how do we sort of acknowledge the broader pandemic? And this may, again, be an area that takes a bit of a backseat over the next couple of months. Did want to note that this was one of the priorities that came out of the work that we heard from across the state in terms of some of the Ending the Epidemic listening sessions that we helped host with Jacqueline and her team and the Division of Public Health. And again, are knowing that that's going to be something that's on the back burner for the time being. Finally, before I pass things to Matt, we were really fortunate and lucky to be able to ramp up some work related to education about the existing Medicaid program through a grant we received from Community Catalyst last year. Have had a major focus in the eastern part of the state. I know we've got a couple of our advocates on the call from Greenville and from Wilmington who've been part of that work. We actually, in many ways, believe that that work has become even more important to educate about the existing Medicaid program. Sierra did a great job of talking about how this is a time to talk about Medicaid expansion, but we are seeing such versatility and flexibility within the existing Medicaid program that we do want to think about how we can lift up what a crucial part of our safety net that program is. Did just want to note, because of the budget impasse from last year, the Medicaid managed care transition has been suspended. It will at some point move forward, but for the time being, the original date I believe the legislature approved was February 1st, 2020, and that is for reasons unrelated to COVID, not moving forward. But certainly may be reaching out to our partners in Eastern North Carolina who are focused on that project, and all of you to think about how we can lift up the Medicaid program. Matt, I will pass things to you next to talk about some of our HIV prevention efforts.
Great. So as Lee mentioned, I think a lot of the work that we are doing specifically around some HIV policy stuff is going to have to take a back burner just given everything that's going on with the current pandemic and things that are arising with that. And we recognize that and we want to be sensitive when it comes to that. But we did want to give a little bit of an update on some of the stuff that we have been working on specifically around prevention and especially around PrEP and PEP policy here in North Carolina. So we have to think about how we're going to handle this during this pandemic, and we recognize that there is still going to be a need for PrEP and PEP during this, but understand that is not going to be the front seat of the fight of what we're doing right now with public policy and public health. So some of the updates of what we're doing: last year, we created a PrEP policy committee of stakeholders from throughout the state. And that's just a group of folks, I think it's around 15 to 20 folks that are people who are working in HIV, people who are working in prevention, people who are community members, to talk through some of the guidance that we are looking forward to in the movement toward expanding access to PrEP and PEP in North Carolina, specifically on a policy level. So we hold calls every 2 months or so just to kind of check in and talk about some things specifically around PrEP and PEP policy with that group. And we'll continue to do that throughout the year and moving forward. We are continuing to work with local North Carolina health departments. We have seen several different models throughout the state as to how to have PrEP programs through health departments. And we are working with the Department of Health and Human Services as well through their PrEP program. And we're seeing a lot of really great work in health departments. And we hope to see more health departments throughout the state continuing to expand access to PrEP programs. We've seen several different health departments throughout the state have some really innovative ways to get PrEP to those who need it most. And we hope to see that continue. And then some other areas of policy change and growth. Oops, sorry, I'm having some technical difficulties. Okay, so one of the things that we have started the process of looking into is researching what it would be like to have a pharmacy distributed PrEP and PrEP program here in North Carolina. We know that this is not something that can happen immediately. It might not be something that can happen in the near future, but it is country. As I'm sure many of you have seen in California last year, they passed a bill that would make PrEP and PEP available through pharmacies throughout California. That is a 30 to 60 day supply of PrEP. It can be done once every 2 years, and it is able to happen without a prescription. There are some stipulations when it comes into that and how that is accessed. And through that, folks can also do a PEP access for the full 30 days of a PEP prescription without without a prescription from a doctor. Through this, we've started some discussions just with several different medical and pharmacy advocacy groups just to kind of get their ideas as to what's going on, see what their thoughts were around this, and kind of like what we needed to move forward to really think about what this might look like if it even is a possibility in North Carolina. We have talked with some of the key organizers from California who started this process, some of the barriers that they ran into, and kind of what they are looking forward to moving forward now that that has gone into place. The law went into effect January 1 of this year, and they are hoping that the program, after kind of figuring out the rules and the training for pharmacists, will start July 1 of this year. There is the recognition that given COVID-19, that some of this might be put on hold and be kind of slower, but just wanted to talk through them as to what their process looked like. I think it's important to recognize that some of the other states that are implementing these programs or looking to implement these programs do have some differences in policy and law. Specifically in California, they had a freestanding law that allowed pharmacists to distribute contraceptives over the counter without a prescription. So the addition of PEP and PrEP was added onto that law. So we do not currently have that in North Carolina, but we are trying to figure out what that would look like if we were to move forward with something like this. So this is all very much just thought-based stuff, talking through with different organizations and advocacy groups as to what possibilities in North Carolina might look like. I think one of the things that we have talked about as a team is that this pandemic has further proven the need for increased health access across North Carolina. And I think it's something that we have known as HIV advocates for a long time, that in order to have access to medications and whatnot, we have to have access to health. And I think this has really proven that over the past couple months, and I think it will continue to prove over the coming months. So moving forward, we are planning to continue dialogue around access to services and barriers to cost, with an understanding of how the components of our health systems work together, whether that be through pharmacies, through primary care providers. Telehealth services, I think, is something that's really taking off currently. And as I mentioned earlier, we understand that PrEP and PEP are going to take a backseat currently with everything that is going on, but we know that these conversations must continue because we do need to still take into account what prevention services are needed for folks throughout our state. So with that, Lee, I will pass it back to you to wrap us up.
Awesome. I'm unmuted, correct? You can still hear me, Matt?
Yep, you're good.
Awesome. So we just wanted to note a couple things about kind of our plans moving forward as an organization. Like so many people, you know, major events are being canceled over the next 2 months and really beyond. Many of you know that we had HIV Speaks on Jones Street scheduled in early June. At this point, you know, we have not made an official call about that event, but it feels pretty unlikely that we will be hosting that in early June. You know, that event, for folks who are not familiar, is when we come together for a day of training and then meetings with legislators to talk about HIV and hepatitis policy issues. We're not even sure if the legislature is going to be in place in early June. So for the time being, you know, I think we're all focused on doing what we need to do to take care of ourselves and respond to sort of the immediacy of right now. So we're not making an official call on HIV Speaks on Jones Street one way or the other. I think we're just waiting to see what the next couple of weeks look like and wait to see what happens in the legislature. We're excited to participate in AIDS Watch on Monday and see what a virtual event like that is going to look like and think about if that's a possibility for us. Also going to consider if postponing or including some of the elements of that event in our conference in the call makes sense. So just wanted to be open and share that with y'all. We know a lot of folks in our network really enjoy that day and are really passionate about that opportunity. So want to continue to lift that up. We are pivoting, as Matt said at the start of the call, you know, want to think about how we keep building community here in North Carolina and how we keep sharing good information with everybody. And are planning to continue weekly webinars at this time, Thursday at 10 a.m. Have 2 scheduled out already. So next Thursday, we've got 2 really exciting speakers who are going to be talking about self-care for people living with HIV. And then on April 9th, are going to focus on harm reduction and look at sort of what are some of the threats to harm reduction policy in North Carolina, and also lift up some of the folks doing really excellent work to pivot and keep providing services during this challenging time. So with that, I know we're pretty close to 11, and Matt, you can move us to the next slide. I want to do just a super quick acknowledgement, actually move on to the next one, of just sort of the team we have here at NC AIDS Action Network. Christina, Matt, Rita, Dante, and Deshay, along with our lobbyist, John Thompson, are all, you know, want to be available and want to be supportive to folks, so don't hesitate to reach out. And I want to give a quick rundown to our funders, AIDS United, the Elton John AIDS Foundation, Cone Health Foundation, Community Catalyst, and the Harm Reduction Coalition. You know, we're getting great messages from them, and we know a lot of funders and a lot of folks in philanthropy are realizing that this is a time that we've got to consider being creative and being thoughtful about how we as a community come together. And Matt, if you move us to the next slide, there's both Matt and I's contact information if people have questions. I do know we have a couple questions in the chat. I also wanted to provide a little time. We know we've got a lot of other experts on the call and folks who, you know, have expertise in this space or this policy work. So if folks, you can unmute yourself if you wanted to chime in with either a question over the line or provide a comment or thought for the group, feel free. We'll probably stay on till about 11:10, but we'll try to wrap up at 11:10. Judy, why don't I ask you to give us I think we've got a couple questions on the chat, and then we can also open it up if anyone else has thoughts on the line.
So we have a question for Alex. What is the income gap for receiving the $1,200?
So for individual filers, the cap is $75,000 adjusted gross income, but your $1,200 does not just drop off there. It is the amount of the direct payment to you reduces by a percentage for every certain either $500 or $1,000 you make more than $75,000. So there's a calculator to it that I'm sure the Treasury will release very soon.
Great, thank you. And I believe this is a question for Lee or Matt. Access to free condoms and syringes has become limited since many of the typical resources or the typical resource organizations. Are there any models that other states or municipalities are using to help with continued distribution?
I think that's an excellent question. And actually, yeah, we've talked with a couple syringe service providers around the state, you know, who are having to think through how they're adjusting. I know many syringe providers have already operated with like mobile vans in the past and have started putting practices in place to still be able to provide, you know, considering social distancing and considering making plans so that people are always 6 feet apart. We do believe that work is really critical and still really important. And I'd say actually, certainly would love for you to tune in on April 9th, I think, when we'll be talking about that on that weekly webinar. What we will plan to do in terms of registration is, I think, for everyone who signed up for this webinar, send out an email with the slides and YouTube video once that's done, and registration for our future sessions. And then we'll also promote that over our NCAN email listserv as well.
Thanks. Do we think Medicaid expansion would pass?
I mean, you know, that is an excellent question. And Sierra and I have worked on that issue together many years, and I wish she was still on the call to chime in as well. But, you know, folks are feeling like this is a moment to be, you know, maybe lifting up the idea of emergency Medicaid expansion could be valuable. We have continued to see a number of more conservative states. You know, Kansas recently adopted Medicaid expansion. I will say I think many of us are a little not completely optimistic, but I also think that as an advocacy community, it is our job to speak out about the benefits of Medicaid expansion. You know, we want to do it in a thoughtful way, and there's certainly a lot of other coalition partners doing that as well. But you know, we've seen other conservative states do it in less public health crises than we are right now.
Great. Do you know if syringe services are exempted as essential services for areas with shelter in place?
Actually, that is a great question that I do not know the answer to. I'm thinking this is maybe the moment to invite sort of the collective wisdom of the call. If someone does know an answer to that question or have a thought, as I mentioned, feel free to unmute yourself and chime in or chat in the chat box. And also I'd say we can transition if people wanted to provide any other thoughts over the line as well. Feel free to unmute yourself.
And you can unmute yourself on the bottom left-hand corner. There should be a little microphone that you click. And we have one more question. All the information you provided, is it similar in South Carolina?
I would say the bulk of Alex's presentation and the federal policy work is certainly the same. You know, the information that Sierra provided during the initial North Carolina update, I would say is potentially very different, you know, yeah.
And someone commented, I know that human services are exempt in Durham's order, so maybe syringe services could come under that.
And I did see, again, Judy referenced Jacqueline Kleinmore, our state HIV hepatitis director, has been providing some really excellent resources in the chat function. She just included a link about specifically syringe services and harm reduction provider operations during the epidemic. So there's a couple resources there, both from the National Harm Reduction Coalition and CDC, that folks may want to take a look at.
And I will be sure when we do the follow-up email, just with the slides and video, I will also include the links that Jacqueline has included. So thanks so much for that, Jacqueline.
Other questions, comments, thoughts that folks have?
We have another question in the chat function, and this may be for Alex. Will there be provisions for currently incarcerated or detained folks to access the $1,200 or receive testing that folks might be able to comment on?
So that, as far as the direct payments go, I would need to research that, just like I've got to research the questions about undocumented individuals as well as documented residents. So I'll have to get back to you on that. As far as testing across the nation is limited already. And we could safely assume that testing in prisons is also incredibly limited. If we look only to Rikers Island in New York, for example, their response to coronavirus has been horrific. There's no way for individuals who are currently incarcerated there to socially distance themselves from one another, and the facilities are not being cleaned or sanitized on any regular basis, and currently only incarcerated individuals who are showing incredible illness are being tested. So we can safely assume that is likely the same across the country. I know that prisoners' rights groups are pushing against that and pushing for more testing and for the release of as much of the incarcerated population as possible during this time. And some states are doing that, but most states are not.
Thanks.
I'm sorry to give such a disappointing answer.
Is there any data on susceptibility of people living with HIV to COVID?
So that's something we're discussing as a community. This is Alex. That's something we're discussing as a broader community right now. Right now, there are no data to suggest that people living with HIV are at more risk for COVID-related illnesses or for acquiring COVID than people who are not living with HIV. However, there are plenty of data that exists about coronavirus so far to tell us that older individuals and people with other chronic illnesses or compromised immune systems are at greater risk. So there's a potential that people living with HIV who do not have a suppressed viral load or who have a very low T cell count as a result of a compromised immune system could be at greater risk for contracting COVID and developing a more serious illness from that contraction. But we don't have direct data about whether all people living with HIV are at greater risk. So far, the CDC and NIH are saying that all people living with HIV should practice extra caution until we have more data.
Great, thank you. Emily, I think that's all the questions we have.
Awesome. Well, Mac, would you like to say a couple final words and then we'll wrap up?
Sure. Yeah, absolutely. So again, just thank you everyone who was able to attend. Thank you to our panelists who presented. Special thank you to Latinas in the South. We really appreciate y'all allowing us to co-host this with y'all and use your system. Take a look out in your inbox over the next probably couple of hours, possibly tomorrow. We will be sending out the slides, other resources, and information as to what was covered today. We have all of our contact information provided in the slides, so you will have access to that as well. Feel free to reach out to us with any of your needs. Take a look out for the other webinars that we've got coming up over the next week. And with that, just thank y'all so much and have a wonderful rest of your Thursday. Stay safe, stay inside if you are able, wash your hands and take care of yourself. Thanks, y'all.